Okay, so I'm going to do my newborn baby assessment. But before we do our newborn baby assessment, I'm going to talk to you about a few things or tell you about a few things. I'm going to tell you about the normal vital signs. The first one I'm going to tell you about is the baby's temperature. When you take the baby's temperature, it should be between 97.7 and 98.6, and that's axillary. When you do your vital signs, you need to take the temperature last because usually the baby will cry. If the baby's crying, it will elevate all of your other vital signs. It'll make them higher. When you take the vital signs, you also need to make sure that the baby's not sleeping, because if the baby is asleep, it'll make your vital signs a little lower than they normally would be. Okay, the next vital sign I'm going to talk about is the heart rate. When you check the baby's heart rate, you need to make sure that you take it apically and you check it for 1 full minute, and the heart rate should be between 110 and 160. The next one that we're going to talk about is the respirations. When you check the baby's respirations, like I said before, make sure the baby's just resting, not crying, because it'll make them higher. When you check the baby's respirations, you should make sure that it's between 30 and 60. And then our last one is the baby's blood pressure. When you take the baby's blood pressure, you usually do that on all 4 extremities. And systolically, the baby's blood pressure should be between 65 and 95. And diastolically, the baby's blood pressure should be between 30 and 60. Okay, the next thing that we're going to talk about is the 4 different types of heat loss. Because when a baby's born, they have trouble regulating their body heat. So the first one I'm going to tell you about is evaporation. And evaporation is basically where the baby's body's wet and the liquids are evaporating from the skin, which will cause the baby to lose heat. And one way to prevent this would be to take a towel or a blanket and make sure you dry the baby off. The next one that I'm going to tell you about is conduction, which is basically laying the baby on a cool surface will cause the baby to lose body heat as well. So a way to prevent this would be lining the table or the area with paper or a warm blanket. The next one is convection, which is basically a draft will take the baby's the heat away from the baby's body. And a way to prevent this would be to move the baby out of drafty areas, move the baby away from vents or air conditioners. And then the fourth one I'm going to talk about is radiation, which is basically where the baby is beside a cold surface like a wall or something, and that'll cause the baby to lose body heat as well. So a way to prevent this would be to move the baby away from the cold wall or the cold surface. Okay, so now we're going to talk about the APGAR score. And the APGAR score, basically what it does is it measures the color of the baby, the heart rate, the respirations, the baby's muscle tone, as well as the baby's reflexes. A little bit about the APGAR scale is if the baby scores a 7 to 10 on the scale, then basically you just need to continue observing or monitoring the baby. If the baby scores a 4 to 7 on the APGAR scale, then basically you need to stimulate the baby, and some ways you could do this would be flicking the sole of the baby's foot or rubbing the baby to try to stimulate it. As well as if the baby scores a 0 to 3 on the APGAR scale, then you would need to start resuscitation. Babies are usually counted off mostly on color on the APGAR scale, so you would need to check to make sure the baby doesn't have any acrocyanosis, which is bluing of the hands or the feet. And when you do your baby assessment, you need to make sure that you do it under the warmer, so that way it'll help the baby to stay warm. Okay, and now I'm going to show you on the baby some things in the assessment. So one of the first things that you're going to look at on your baby is the fontanelles. And you have the first fontanelle you look at will be your anterior fontanelle, which is up here. And that would be diamond shaped. And normally this would close between 12 to 18 months after birth. And then the next fontanelle you have is the posterior fontanelle, which is back here, and that is triangular shaped, and this usually closes by the end of the second month. If your fontanelles are sunken in, then this is usually a sign of dehydration. If your fontanelles are bulging, then this is a sign, it could mean increased intracranial pressure. Another thing you would need to check with the baby's head is the caput succedaneum, which is swelling on the baby's head. And how you would be able to tell this is that this one would cross the baby's suture line. So it would be on both sides. And then another one that you would look for on the baby's head is the cephalhematoma, which this one would just be on one side or the other. This one does not cross the suture line. And then another thing that you would check for is molding of the baby's head. And basically molding of the baby's head, all this really is where the bones in the baby's head, they shift and shape to where the baby's head can pass through the birth canal. And then you would measure the baby's head, the circumference of the baby's head at the brow line. And then the next thing that you would go check for would be the baby's eyes. You would make sure that the baby's eyes are symmetrically. If you have a term baby, the baby's eyes would be a slate blue color or a grayish color, and they would be clear. If you have a preterm baby, then the eyelids would still be fused shut. And then you would go and you would check the baby's ears. And in checking the baby's ears, you would make sure that both of the baby's ears are symmetrically. You would look inside the baby's ears to make sure that they're clear. You would also fold the baby's ear down to check for recoil. If when you fold it down, if the baby's ear does not recoil instantly, then you have a preterm baby. But when you fold the baby's ear down, if it recoils instantly, then you have a term baby. The next thing that you would check are the nares, and usually babies are mouth breathers. So to check the nares, you would use your thumb and close the baby's mouth and close one side of the baby's nose at a time. And when you do this, you would watch the baby's chest to make sure it rises. And you would make sure there's no nasal flaring or anything like that. If there is nasal flaring, this could be a sign of respiratory distress. Then the next thing that you would check is you would check for cleft lip. You would also, in the baby's mouth, you would put gloves on, of course, and you would use one finger to stick in the baby's mouth to check the baby's cleft palate. And then while doing this, 3 of the reflexes that you could check while doing this is the sucking reflex, which the baby would suck on your finger when you stick your finger in the baby's mouth. The next one you could do would be the gag reflex, which is where you would stick your finger farther in the back of the baby's throat and the baby should gag. And then another one that you would do would be the rooting reflex, which is where you would rub the baby's cheek and the baby should turn its head toward the cheek that you're rubbing. Also, while you're up here at the baby's mouth, you would check for blueness around the baby's mouth, which could also be a sign of respiratory distress. You would also check for Epstein pearls in the baby's mouth, which these are little white pinpoint spots on the roof of the baby's mouth, and these usually go away. And then the next thing you would take your gloves off, and then the next thing that you would check would be Mila on the baby's face, which is usually on the baby's face and on the nose. These kind of look like baby acne. You would need to be sure to let the parents know not to try to pop these or anything like that. They should go away. If they do try to pop these, you need to let them know that it could cause the baby to have an infection. And then the next thing you would need to look at would be the baby's skin. And while looking at the baby's skin, you need to know if it is transparent or sticky. And if it is, then that would indicate that you have a preterm baby. If the skin is if it's not transparent and it kind of looks like it's cracking a little bit, then this would mean that you have a term baby or a post-term baby. And then while you're looking at the baby's skin, you would also check for vernix on the skin, which is a cheesy-like substance. If this is all over the baby's skin, then that would indicate that you have a preterm baby. In a term baby, you would normally only see this in the creases of the baby. And then you would check the baby's skin for birthmarks. Some of the birthmarks that you would look for would be the stork bites, which is also called the angel kisses. These you would usually see on the face or the nape of the neck. And these are pinkish areas that are blanchable. Usually these fade and go away over time. And then another birthmark that you would look for would be the strawberry hemangioma, which is a reddened, raised area, and basically this is kind of like a protrusion, and it can be anywhere on the body, and it is blood vessels, it's a cluster of blood vessels that will go away over time. Another one that you can look for is the port wine, and that is like a reddish purplish area that can be anywhere on the body. Now this area would not blanch, and this birthmark would not go away, so it's a permanent birthmark. Then you would check for let's see, it's webbing of the hands and feet. I'm trying to think what it's called. It's called the sandactyly, I believe. It's webbing of the hands and the feet. You would check that. Then you would also check polydactyly, which is the baby would have an extra digit, so it would have like an extra finger or an extra toe on the hand. You would also check for, on the baby's hand, the Semen crease, which is a crease that would go all the way across the baby's hand, and which that could be an indication of Downs, but you would check for that as well. Then you would go down to the baby's abdomen, and you would check the baby's breasts to make sure that they are symmetrically. You would also check you check the baby's breasts to make sure they're symmetrically. You would also know if the baby has prominent breast buds. In a term baby, you would see this, and they would be about 5 milliliters, a little bit more. And in a preterm baby, the breast buds you would not be able to see at all. Also, while checking the breast, there can be witch's milk that is secreted, and it's secreted from the baby's breast. You will also notice some engorgement, and with engorgement, basically you can see this. This is usually from the mother's hormones and utero. Then the next thing you would do to the chest is you would auscultate the baby's heart rate, and you would make sure that you done this apically, and you would need to make sure that you do this for 1 full minute. And like I said earlier, the baby's heart rate should be between 110 and 160. That's normal. Also, while you have your stethoscope, you can listen to the baby's respirations. Make sure you listen to them bilaterally. In a term baby, the respirations, they should be clear. If you notice any grunting or nasal flaring or retraction in the chest area, this could be a sign of respiratory distress. Also, one thing you need to know about the lungs is surfactant. It's very important. Surfactant, basically, it helps the baby to breathe, and basically what surfactant does is it lubricates the lungs to where the lungs can expand. If you don't have any surfactant, then your lungs, they may collapse. A preterm baby would normally not secrete surfactant or be able to produce surfactant in the lungs, so you would need to make sure that you watch for that, for the baby's lungs to collapse. Then the next thing we can talk about is the 3 shunts that the baby has while in utero. And one of them is the ductus venosus, which shunts from the liver to the inferior vena cava, and this usually closes with an umbilical cord is cut. Another one is the foramen alveola, and it diverts blood from the right atrium to the left atrium, and this normally closes about 2 hours after birth. And the third shunt is the ductus arteriosus, and it diverts from the pulmonary artery to the aorta, and it usually closes within 15 hours after birth. Something else, another thing, let's see. We also will check, at this time you could check the baby's brachial pulse, which is usually in the baby's bicep. You also can check the grip reflex, which you would do this by putting your finger in the palm of the baby's hand, and the baby should close his hand around your finger. Another thing we can check for is the tonic neck reflex, which is basically where you turn the baby's head, and the extremities on the side the baby's head is turned should be straight and relaxed, and the extremities on the opposite side should be flexed and drawn up. And then another thing that you will check for is the Moro reflex, which basically you can do this by clapping your hands or slapping the table the baby's laying on, and this should startle the baby to where the baby will cup their hands like a C and kind of bring them inward, so it would kind of do this. That's a reflex you would need to check for. Then, when you go back to the abdomen, you need to make sure that the abdomen is soft and that it's not hard or anything. Then, after you do that, you would need your stethoscope, and you would need to check for the baby's bowel sounds. Make sure you check for them in all 4 quadrants. Okay. And while you're down in the abdomen area, you can look at the baby's umbilical cord. And the baby's umbilical cord has 2 arteries and 1 vein. The 2 arteries would carry blood away from the baby, and the vein would carry the oxygenated blood to the baby and the nutrients. Also, you would have Wharton's jelly, and Wharton's jelly is a soft-like jelly that would be on the umbilical cord, and this is pretty much, it protects the arteries and the vein. It's kind of like a cushion. Another thing is, just a few minutes after birth, the umbilical cord can be used as a site to take the pulse. And then something else, then we will move down to the baby's genitalia. And if you have a female baby, if the baby is full term, the baby's labia majora should cover the labia minoris. If the baby is preterm, then the clitoris is prominent, so you'd be able to see it, and the labias would be flat. And then in a male baby, if it is term, you should be able to see rugae, and you should check both of the testes to see that they have distended. In a term baby, they would have distended down. Also check the urinary meatus to make sure it is on the penile tip. Also, while you're checking the genitalias, you will also check the baby's anus to make sure that it is patent. Also check to see if the baby has passed meconium, which is the first stool after birth, and they should pass that within 24 hours after birth. Also going down, you would check the baby's gluteal folds, which is back here. You would need to make sure that the gluteal folds are symmetrically. And you will check for hip clicks in the baby, which is basically where you would take the baby's leg and you would rotate it. And if you hear any clicking while you do this, then that's called hip clicks. And that could mean displacement of the hip. Also, you would need to check the Babsky reflexes, which is you would basically run your finger up the side of the baby's foot, and the baby's toes should flare out, kind of like fanning out, and you would do this to both of the baby's foot. Also, while you're on the baby's foot, you would need to check for creases on the soles of the foot. In a term baby, you would have a lot of creases on the sole of the baby's foot. In a preterm baby, the soles of the baby's foot would be smooth and you would not be able to see any creases. You will also check the baby's posture, which is part of the Ballard's scale. In a full-term baby, the baby's posture would be flexed, so its arms would be drawn up and its legs would be drawn up in a flexed position. In a preterm baby, the extremities would be relaxed. They would not be flexed at all. You would also check for the square window on a baby, which is basically you would take the baby's hand and curve the baby's hand like a square, and if it makes a square, then you have a term baby. If the hand goes all the way down to the wrist, then you would have a preterm baby. Another thing that you would check for is arm recoil in the baby. In a term baby, you would basically straighten the baby's arms out, and the baby should recoil its arms back up. In a preterm baby, if you straighten the baby's arms out, the baby won't recoil them. They'll just be extended. Also, something that you will check for is the popliteal angle, which is basically you will pull the baby's leg straight up. If the baby pulls its leg straight up, then you have a preterm baby. If the baby, when you pull the leg up and it goes at like a 90-degree angle, then you have a term baby. Also, you will check the heel to ear, which is basically where you would pull the baby's leg up to the ear. If the baby's leg goes up to the ear all the way, then you have a preterm baby. In a term baby, you will have resistance and the baby's heel won't be able to go all the way up to the ear. Also, something that you will need to check for is scarf sign, which is basically you would take the baby's arm and pull it over the chest. If the baby's elbow is midline with the chest, then you have a term baby. If the baby's elbow goes past the midline when you do this, then you have a preterm baby. And another thing you will check for is the Harlequin sign, which is basically you roll the baby over, and this side down here that the baby's laying on would be red, and then this side up here would not be. I believe this is usually noted in preterm babies, or that's what my book said anyways. Also, you will turn the baby over, and you can hold it like this. You would you'll look at the baby's back, and you would check the baby's spine to make sure that it is vertical and midline. Also, while back here, you will check for Mongolian spots, and they kind of look like bruises, but they're not bruises, and these would definitely need to be noted in the baby's chart, because if the baby has these can be mistaken for abuse. And you will also need to check for tufts of hair back here on the baby. If you see tufts, this could be a sign, an indication of spina bifida. And let's see, another thing I forgot to mention was while you're checking the baby's skin, you need to check for it looks like peach fuzz hair all over the baby's body. If there is a lot of this peach fuzz hair, then that would mean that you have a preterm baby. If you have a term baby, there will be little peach fuzz hair to no peach fuzz on the baby at all. And that concludes my head to toe assessment of a newborn.